If you're watching this video, that means you were unable to attend our live class, which is totally fine. But we do still want to have that personal connection with you. So what's nice about watching a video is that you can pause it anytime, take a breather, take a rest, and you can write down your questions. So if you have any questions when you're done with this video, feel free to give us a call and we can connect and answer your questions one-on-one. Now, I personally love teaching patients and going over this education with you before you have surgery because I've been working in the field for about 30 years in the hospital with physical therapy, and I've had multiple surgeries myself. And I feel like we shouldn't assume people know this stuff. So by sharing this information with you before you have surgery, we're hoping to build confidence and kind of empower you to really understand what's going on so that you're not worried or scared as you come in to have surgery. Specifically with spine surgery, there's a lot to know. So in this class today, we're going to talk about and go over the anatomy and talk about the spine and the parts of the spine. We're going to talk about the planning that we do through the hospital and what you need to do before you come in and have surgery. What will happen at the hospital while you're here. So before surgery, during the operation, and then after, the things that you need to do. And then we'll talk about your recovery. We want your home to be ready for your recovery when you leave the hospital. Okay? So I like to start at the basics about your anatomy when it comes to the spine. Our bodies are set up in a specific way to carry everything that our bodies need to do. This is a very complex machine that we're living in every day. So just to back up and give you a little basics here, we've got our central processing unit, or the brain itself that tells our body what to do, up here at the top. Our most important parts are protected with bone. So the skull is protecting that, which makes it kind of heavy. And that is balanced on top of our spine that comes all the way down here. That spine is made up of bones and disc material. And mostly what it's there to do is to protect the brain's extension, the spinal cord that comes down through here. Okay, so that's very important. It needs to be protected. And the vertebrae that are making up each one of these are bone. And that bone is protecting it on this side and on this side. We'll go into more depth with that later. But the way our spine is set up is in 3 different sections. So we've got the section here that is labeled cervical, that's your neck. We've got the thoracic section, which is the middle 12 vertebrae here. And then we've got the last 5 here, which is the lumbar, or your low back. The majority of our spine surgeries that we have here seem to be involving the cervical and the lumbar. Rarely do we see them as much in the thoracic, but we do. This down here then is the sacrum, and then we've got the little tailbone or coccyx at the very bottom. So if you're having an L5, S1 surgery, that is saying you're going to have that last lumbar in between that one and your top of the sacrum here. So that's the area that your surgery would be. Okay, so with our anatomy, we've got the normal curves that make up that spine as well. If our spine was very straight and more like a pile driver, it wouldn't be flexible and you would have more pain. So we've got these natural curves that make up our spine. They're there for a reason, to make it more like a shock absorber. The bones provide structure and protection. The discs are shock absorbers and for flexibility, and they're in between each one of those bony parts. Okay, the facet joints, those make up where the bones come together in the back, and those are flexible and should be able to move. They're there for structure, protection, and flexibility, and we can build bone spurs there, and that's why we need to talk about that when it comes to surgery. Ligaments connect bone and discs together, and nerves are the way the brain then communicates through the spinal cord, and then out each one of those levels comes a nerve, and that's what communicates from the brain to the rest of our body. They help us to move and to feel. They tell our muscles what to do. They tell us if there's hot or cold, if there's pain. And then the muscles help us move and stand up straight and tall. It is our muscles that keep our posture where it should be, and that's very important. It's so important that I gave you a whole slide on our muscles. So every one of us have every single one of these muscles, and they come in layers. We've got the outside layers of muscles through our back and through our abdomen that help us protect. All that's going through our core. And the core is a term that you hear a lot of these days. We need to keep our core strong because that helps to protect our spine. So if we go underneath each layer, we got the big muscles we see on our bodybuilders that you know, if you see pictures of people like that, and then we take away those layers all the way down to these tiny little muscles that go from vertebra to vertebra, okay? Now, not everybody that has back pain needs spine surgery, and so I want to go into that a little bit because we want to do the least invasive procedure if possible. So if you maybe have lifted something incorrectly and it strained one of these tiny little muscles, that would be very painful. But that doesn't need surgery. That would need physical therapy. We do physical therapy, that heals, and then you're going on your way again. And then hopefully you got some education on how to lift correctly off of that. So just want to make sure you understand we all have all of these muscles. That would be an example of a reason why back pain didn't need to have surgery. You're watching this because yours is more involved than that. But that's just showing you how important all these muscles are. And I want you to know that because after spine surgery, you're going to want to take responsibility and really make sure these muscles are doing the best that they can for you to protect what the doctor does for you. Okay? This is a cross section of one of those vertebrae. So the vertebrae, the bony part here, that's underneath that disc that you see there, and it is the same shape, which is very cool. So you got the strong part that's protecting the spinal cord underneath that there. You've got the flexible part, the disc that sits on top of that in between each one of those vertebrae. Okay, the discs are pretty amazing. On the outside part, this is flexible material. It's strong, but it's still flexible. And then on the inside is a more jelly-filled donut type material, so that it's even more flexible. So that's how it's set up so that it can be help you move and help that from being a pile driver on your back, so that everything's protected like it should be. Spinal cord comes right up through this opening that's in the middle of each one of those vertebrae. And the bony part off the back side here is protecting the spinal cord from the back side. This guy right here is the bump that you feel if you run your hand down your back. Those are the bumps that you're feeling there. These are the nerve roots that come off each side of the spinal cord. Remember, that's bringing the message from the brain. Then from there it goes out to each level. Okay, and I'll explain that a little bit more. This guy right here on this diagram, that's your sciatic nerve. He is a big one. If he gets pinched, he's really mad and he will talk to you. And this right here is one half of the facet joint that we were talking about earlier, where some arthritis can build up. So this is a slide that's demonstrating some conditions that can happen with the spine. Okay, so this is the normal setup. We've got a nice fluffy disc here that's helping to make that opening where the nerve root comes out be nice and wide. We've got healthy vertebrae bodies here, and so that's the way it's supposed to look. This, unfortunately, is what happens over time with many people. Things get dehydrated. None of us drink enough water these days, and things can get cracks in it and start to squish down. Okay, with weakness in the outside of that disc material, the inside jelly-filled donut part can squish out. So this is what we call a bulging disc right there. And you need to know anything that is impeding on this space here for that nerve root to come out, it's going to pinch on that nerve root and it's going to make it mad. Okay, so that's already making it mad. This condition right there could be favorably affected with physical therapy. So a lot of times that's why they will start with physical therapy. If that's the case, that could suck back in. You learn how to lift correctly, get some good tone through your core muscles, and then that's successful. If that inside disc material continues to squish out and it actually herniates, that typically needs to have surgery, and that is very painful. It's not a big surgery, it's very successful, but it does usually need to have surgery to fix that. So if you know you're having a microdiscectomy, that's typically the reason why. Okay? This picture right here is this just getting worse as that continues to thin and wear out. Then it's degenerating down. That is what happens. As that gets narrower and narrow, this is getting smaller and smaller, less room for that nerve root to come out and move it freely. As bone gets closer to bone and we continue to try to move and do our daily work like we need to, if bone's touching bone, our body builds bone spurs, and that's what you're seeing here. Many of our patients that are having spine surgery are because of bone spurs. So you can imagine if it is bony and it is pinching on that nerve root, that's going to be very painful, and physical therapy does not remove bone spurs. Okay, so the bone spurs are painful and it can be pinching on a nerve. This slide here is showing you a map of what each one of those nerve roots is communicating with. At this point, I'd like to show you my model because this kind of shows you how those nerve roots come out at each level of those vertebrae. Okay, so they're little yellow nerves that come out at each level. Okay, this right here is a herniated disc that is pinching. That's an example of a herniated disc pinching on the nerve root. Okay, so that's each one of those nerve roots that I'm speaking of as we look at this map here. All right, so they have been able to map out exactly what each one of those nerve roots communicates with. So if you have a pinched nerve at C6, okay, you probably feel pain, numbness, and tingling all the way down into your thumb. It is that well mapped out. Same thing with C7 for these two fingers here. Okay, as well with the low back. If you have a pinched nerve at L4 or L5, you can follow that map all the way down, and that nerve L4 affects the top of your knee and the front of your shin right here. L5 affects the feeling in the top of the shin right here, all the way down to the top of your foot. Okay. At class, I typically hand out a copy of this so you all can have one of your own, but you can also go on the internet and Google dermatomes, and this map, this pretty rainbow-colored man comes up, and you can see that for yourself there. This is really important because you need to understand, you know, if a nerve is pinched long enough, usually what you'll feel is pain, and then you'll get numbness and tingling. And then if the brain cannot speak to this muscle right here and tell it what to do just because it's been pinched off, the communication has stopped, then have you heard of the term drop foot? That's where that foot can't be picked up, and it's nothing wrong with the muscle, it's just not getting the message from the brain because the nerve is being pinched in the back. So a lot of people will have surgery in the low back and start to have issues with this kind of stuff. That will get worse if you don't have surgery, and it could possibly recover by having that, whatever's pinching on that nerve be removed, and that's what the surgeon's going to do in the operation. Now we're just going to review a few spine conditions. Your condition is probably in one of these. I'm just going to go over this quickly because your surgeon should go over with you very specifically what it is that he's going to do in your spine. Okay? But these are common conditions. Spondylolisthesis is a slippage in the vertebrae. Obviously, if this is happening, we've got some very strong pinching going on right there. Very painful. Doctor needs to line that up again. This is stenosis. I see this often on our spine surgery list of diagnoses, and that's where the bone spurs are building. A lot of times people will call this a roto-rooter type procedure. Doctor goes in, cleans up the bone spur. In this example right here, the bone spurs are actually pushing on the spinal cord. So anything from that level down will be affected. Those bone spurs can also be affecting the nerve roots that come out each side. So bone spurs are hard, and they're going to be pinching on that nerve. The doctor needs to remove those, and that's what happens when they work on stenosis. Here's an example of a microdiscectomy. So this picture before surgery would have been one of those where this disc material here was squished out like that. Doctor makes a small incision, goes in with his tools. They remove a little piece of bone so they can get in there, and they take those pieces of that inside of that disc material out until they get all the way back here. So now it's no longer pinching on that, and that was really angry when the disc material was pushing out like that. Okay, so now we've relieved that pressure that's on that nerve root. It's not a very big incision, so that heals up pretty quick. You do need to know that, and these people tend to go home the day of surgery, but the doctor doesn't put anything in there. So what's very important for our patients to understand is you need to follow the doctor's orders as far as your activity level. You may feel quite a bit of relief compared to what that felt like when your nerve was being pinched, but it needs time to heal. Okay, so definitely follow your doctor's instructions as far as your activity level goes. Just because you feel better doesn't mean that it's time for your anatomy to do too much activity. So just follow his instructions, or hers, your surgeon's instructions. This is an example of a laminectomy. This is where bone was pushing on the spinal cord or the nerve roots, and the doctor maybe needs to take just a little more bone out. And then this is an example of a fusion, spinal fusion. With this procedure, what I like to explain is, because it can be kind of scary to hear about having to have a fusion, but what was going on in your spine is your body was building those bone spurs, and this picture before surgery, those would have been touching. So the disc had worn down to the point where those two are touching. We're building bone spurs, not in an orderly fashion, so they're pinching on things. Doctor goes up and cleans all that out. And he opens that back up again, and they'll put maybe a cage in there with some bone chips so that it holds that space open so your nerve root has all kinds of room for it to freely go where it needs to communicate. Okay, this is supposed to fuse, and on top of that, they put in hardware that helps to reinforce that and make it more secure. Okay, now when the doctor was instructing our staff in taking care of these patients, we were like, it seems kind of scary to have a patient that had a surgery like this get up and walk the day of surgery. And the doctor reinforced in us that this is way more stable than the spine that patient walked in with that morning. So we also want you to have that confidence. Understand that this is a very stable surgery. He took out the part that was pinching on your nerve, and he's opened that space up again. So your prognosis is great, but you also have to take really good care of it. It's a little bit bigger incision, a little bit longer surgery. So you had surgery. There will be surgical discomfort, but what you have after surgery is way better than what you came into the hospital with. So the staff will ask you to get up and walk the day of surgery, even after a spinal fusion. This is an example of a disc replacement. This is actually a patient 6 weeks after surgery. So before surgery, those two vertebrae were touching, building bone spurs. He went in and cleaned that out, and then the disc replacement, we've got the titanium pieces on each side. You can see those on x-ray after surgery, and then the disc material in the middle doesn't show up on x-ray, so it looks like it should look. So these have healthy discs in there. Discs don't show up on x-ray, so that's the way it should look if it's healthy, and so that's how that looks there. So that's kind of exciting. You don't see those in the low back, unfortunately, very often, if ever. And not as often as I would think in the neck. Your doctor is going to determine if you can have a disc replacement or if what you need is actually a fusion. Okay. So now before you come in for surgery, these are some of the appointments that we expect that you're going to have. Now, with your surgeon themselves, they should be reviewing your medical history and the benefits, the risks, and other alternatives for this surgery. Is there anything else you can do? He should go over all of those facts with you so that you make a good informed decision on whether you should have this surgery or not. Typically, this type of surgery is what we consider elective. We've got options for you, but it's still your choice. It's not life and death, usually, okay? So that's what that one's about. So you're making a good informed decision about whether you should have surgery or not. They should be going over all of your medications. What medications are you taking now? What medications should you stop taking the day of surgery? Blood thinners are ones that for sure we want to be talking about. They don't want you to take blood thinners before you have surgery. And I don't know if everybody understands that a lot of the over-the-counter drugs that you take also thin your blood. So we've got the heavier blood thinners, Coumadin, Xarelto, those kind of medications, and then also Aleve, Advil, naproxen, ibuprofen. Those kind of medications are also called nonsteroidal anti-inflammatory drugs, and they also should be stopped the week before surgery as well. They're going to give you a call. They want to get in your chart here, your medical history and any current medications that you're taking. They'll list them in our electronic medical record here at the hospital. You'll have some lab work that will be ordered, and the lab here at Legacy Salmon Creek is in the ground floor, Suite 150 of our medical office building. Okay, and then they will also ask you about any food and drink restrictions. There will be a phone call from our patient access department to confirm all of your insurance information and contact information. So if you have somebody that's going to be helping you, driving you home from the hospital, anybody that we need to call, please update that information as well. Okay, and one thing that Legacy is really holds as important is that you have significant or sufficient care at home, somebody that will help you out after surgery. And so that's what this part is. As you're preparing for surgery, we want to make sure that you have somebody that's there for you. 2 sets of ears and eyes are better at getting all this information in than only one. So if they could go to all your appointments, that would be wonderful. You're not going to be able to drive after surgery, so plan to have somebody bring you to the hospital and bring you home from the hospital and all of your follow-up appointments. And then we have on here somebody to take care of you for 1 to 2 weeks after surgery, which would be optimal. But we also know that there are people that live alone and are very independent in that. Now, if you can assess your situation, knowing that if you're having a bigger surgery, like a fusion, that may be great. That would be nice to have somebody for a couple weeks. If you live alone and you're independent and you're having a microdiscectomy, you might need somebody for 1 or 2 nights. So we just want you to kind of plan as far as that goes. They don't need to stay if you don't need them any longer. It is also your responsibility to make sure you know about your condition and your surgery, so please ask questions. You can call our office. Definitely be asking your surgeon about procedure-specific questions as well. Make sure you understand what it is that they're going to do. And then, of course, to keep and maintain your healthy lifestyle as you're preparing for surgery, make sure your body's in good shape, which that includes, hopefully, eating a balanced diet. So really understanding that the cells that are going to be needing this strength to heal, they're made up of what you take in. So the nutrients in your food, so Cheetos and Twinkies don't have a lot of nutrients. So understanding that fresh fruits and veggies, proteins, carbohydrates that are healthy, that's going to be important for you before surgery and after. Drinking plenty of water is also very important. We like people to be really well hydrated, to the point, in fact, we understand that people actually recover better from anesthesia if they've had enough water to drink. So we actually want you to hydrate well with water coming into surgery the days before. Make sure you're drinking plenty of water. We also allow you to have clear liquids all the way up until 2 hours before your arrival time. So you don't have to stop drinking clear liquid at midnight the night before surgery anymore. So it's that important. It will actually make it easier for the nurses to start an IV or for you to recover from anesthesia. So the hydration is really important. That hydration also will help with the next one, which is keeping your bowels regular, and that is very important. We know that narcotic pain medication can constipate people. We know that anesthesia can kind of shut your gut down as well, and we'll probably give you a narcotic pain medication after surgery if needed. And if you take it before, what we want to make sure you're very aware of is please don't come to the hospital for surgery constipated. So know what works for you. We have a list of things and a shopping list we can even give you. So if you call our office and you have that, or if you have a medical clearance appointment before surgery, they will cover all that as well. We don't want anybody to have to come back to the hospital because their bowels have backed up after back surgery. That will also be very uncomfortable. Please limit drinking alcohol. Take good care of your skin. If there's any nicks, scratches, abrasions, rashes in the area that the doctor is going to make the incision, they will most likely cancel your surgery. That's the whole part of preventing an infection. We're going to start with the condition of your skin even before you even come in. Okay, so that needs to be in good condition. We do recommend quitting smoking, and it's not just about your lungs, but we do know that tobacco products affect the circulation, so that it will make it harder to heal if you are a smoker. So we want to make sure, especially if you're having a procedure like a fusion, we don't want that to fail. So know that plays a part in that, any tobacco products. And then to remain as active as you possibly can despite what you have going on, but keeping the lungs working and the blood pumping and your muscles working as much as possible before you come in for surgery will make your recovery better. Okay, so that's why those are all there. This is for before and after surgery for your healing quickly and well. And then one thing that we really want to make sure for our surgical patients also is that you know that falling is not allowed after surgery. So this is where you're going to go into your recovery environment at home and make sure that it is safe and it is a good recovery environment for you. Know that most all of our surgical patients, we expect them to go home the next day. So if that's the case, you're doing well enough to go home, you need to have a good recovery environment at home. So make sure that there's no loose throw rugs that you could be tripping over. Pick up any clatter. We need you to be able to get up and walk around a little bit. So make sure that there's areas for you to be able to do that. So nothing you're going to trip over. Cords across walkways, boxes, that kind of stuff. Get them out of the way before you come in for surgery. Have items that you use often within reach. Know that after spine surgery, if you're having a neck procedure, you're not going to be reaching up overhead. So if there's things up high that you need, make sure they're down where you can get to them. And for low backs, anything down low is going to be an issue as well. So having them right where you need them is the best thing to do. Plan ahead. If you have stairs, we're going to want you to have a good sturdy hand railing. A lot of times if there's a pinched nerve in your back, you may have weakness down one leg or the other, and to be able to hang on, it will be the safest thing for after surgery as well. If you can prepare some meals, put them in the freezer ahead of time, then neither you nor your helper has to worry about what to cook for dinner. That is very helpful and a stress reducer. Having all your regular medications filled ahead of time and at home already will be great. And then as far as assessing your furniture at home, kind of figure it out now. What works well for you now in the discomfort that you have and why you need to have surgery? If you have a low squishy couch and that's hard to get out of now, it's going to be difficult after surgery as well. Assess the bathroom. If the toilet is really low, maybe you need a toilet seat that's raised up a little bit. So those are all available at medical supply stores as well. The furniture, assess that. If you've got a comfy recliner chair, but it has you in bad posture when you sit in it, that's not going to be okay after surgery. You want furniture that has you in a good posture where your spine is all lined up like it should be. Okay, so really be assessing that. It might be a good time to acquire something that fits you well: mattresses, pillows, chairs, and the toilet seat. So just really be assessing that now. Oh, pet care. If you have pets, you know, having somebody else be walking the dog or taking care of kitty litter boxes, that kind of stuff, that is a great thing to plan ahead for as well. So now you're getting ready to come into the hospital and you're packing your bag. What should we bring to the hospital? If the doctor issued you a brace to support your back and you have that, please bring it into the hospital. We'll need it here after surgery for you to use. Toiletries, of course, you can bring those. We do have the basics here, but it's nice to have your own. If you have glasses, contacts, hearing aids, dentures, all those smaller things that are very important, they tend to be pretty expensive as well. So if you have a case with your name on it, bring that as well. If you use a CPAP machine, please bring it. They will use that, but it does need to be clean. complete and in working order. And then as far as what to wear, if you can bring some clothes, we want you to be dressed as soon as you can. So something that's comfortable in the bed, something loose fitting around that incision and it's easy to get in and out of. If you get dressed in your own clothes, you're going to feel healthier and that's more comfortable. So that's why we want you to bring some loose fitting clothes, but please leave all of your valuables at home. All right. So here we're getting closer to coming in for surgery 2 days before. No shaving or waxing near your surgical site. That again is protecting the skin, so no accidental nicks or scratches. If there's any hair in that surgical area, the nurses in the prep area will take care of that. So don't worry about that. 1 day before surgery, Legacy calls you with the time that you're supposed to be arriving at the hospital and what time your surgery will be. Then the night before surgery, this is when you start the showering process. Now at your pre-admissions appointments or at the surgeon's office, they should have given you a pack of this pre-op surgical scrub. This is going to start the germ killing process, and there's instructions in there so you don't have to memorize what I'm saying. But this is kind of the process here. This is the germ killing process, so we want to make sure that you've got clean sheets already down on the bed, you've got a clean towel ready to go, and you're going to use the special soap from the neck down. And if you have a partner that is in the bed as well with you, then they need to also use an antibacterial soap. And then we're going to use a clean towel after that shower. Then we're going to sleep in clean bed sheets and clean pajamas. And no pets will be sleeping with you, okay? Now you're going to get a good night's sleep, set the alarm so you get to the hospital on time. That next morning, you use the second bottle of that soap, okay? So you're going to use another different clean towel as well. You're not going to put on any body lotion, deodorant, or makeup, and you're going to dress in clean, comfortable clothes, okay? Then arrive at the hospital at your check-in time. Now remember, if there's any questions at all with any of this information, there will be a time for you to touch base with us on the phone and we can answer those questions. So just write them down if you have any questions. All right, so just going to walk through a little bit what it's going to look like while you're here at the hospital. The nurses are going to get you ready for surgery. They're going to change you into a special gown. They're going to start an IV. They are going to clean the area that the doctor is going to do the surgery, okay? Your family member can be there with you in this area. They're not big rooms, so one person is plenty. But you also get to meet with your surgeon. So you get a last-minute meeting with the surgeon. He's going to come in and sign the area that you're going to have the incision on so that the staff in the OR knows that both you and the surgeon agreed. That's where you're going to have surgery. And any last-minute questions about the procedure, you can ask him then. You also get to meet with the anesthesiologist in the prep area. And at that point, you can talk to them about anything that you're worried about as far as maybe if you've had surgery in the past and you had issues with nausea, that kind of thing. So let them know ahead of time. They'll talk that through with you. Anesthesia has improved so much, and how they treat nausea and that kind of stuff has improved to the point where people do quite well after surgery, and if you share that information with the anesthesiologist ahead of time. So make sure I want to empower you to talk to them ahead of time. Those are also the people that order the pain medication after surgery. So if you take a narcotic pain medication before surgery, now in this time, and you know certain medications work and certain medications don't, this would be the time to remind them, this is the medication that works best for me. Please make sure that's the one that is ordered after surgery. And if you take larger doses of pain medication, if you haven't already had that conversation with your surgeon, make sure you do so that he knows what they order after surgery. Is that going to be equivalent to what you've been taking now? Because you know how your body works on that. So just those is a good time to have those conversations now with your doctor and at this point at the prep area. A good reminder there, okay? Behind this smoky wall here is a waiting area for your coach person. So they can wait there. There's a TV on the wall that shows a number that's been assigned to you so they know where you are in the process. Typically the surgeon will call you after the procedure and let you know that everything went well. So if you go upstairs to the cafeteria during this time, make sure the staff has your phone number so the doctor can call you as well. Okay. The surgery itself takes about anywhere from an hour to 6 hours, depending on the procedure. This is a picture of the operating room. We like to show you that just because you are awake when you wheel into the operating room. You'll see the people in blue scrubs. You'll see the big lights, and it's on the colder side. That's why we love our warming gowns, which I will introduce to you in a minute. Typically, the anesthesia is a general anesthesia, and that starts once you've arrived in the operating room. So then you wheel in, you're aware of what the room's like. The anesthesia starts with the team in there. Next thing you know, you're in the recovery room. So you wake up from surgery in the anesthesia in the recovery room. These nurses are going to make sure your vital signs are good, make sure you have good pain control, and monitor your incision. Okay? After the recovery room, you will be taken to either inpatient stay hospital room, or if you're planning to go home the day of surgery, you'll go back to the short stay area where you came from originally. So discharge after these procedures may be the same day as surgery or the next day. If you need to stay any longer in the hospital than one day, and for medical reasons, that is not a problem at all. But typically we like to get you in that frame of mind that you will most likely go home the next day, so that your coach, your family members, your support people are prepared and ready to take you home. To be able to go home, these are the goals that we want to achieve. You will have good pain management. You won't have any nausea. You will be able to eat and drink. To be able to treat your pain. We like the ice packs for that, and be able to get up and go for short walks. If you stay the night in the hospital, we do like our patients to be getting dressed that next day. Even if you're going to stay in the hospital, it makes you feel healthier to be in your own comfortable clothes. The nurses are going to be taking care of your surgical site and instruct you on how to care for that once you get home. And if you do spend the night, typically physical therapy will come in and see you, make sure you're doing okay getting in and out of bed and getting up and walking. All right, we like to talk a little bit about avoiding post-surgical complications, and that's what this slide is about. Seems like wasn't too long ago, we as medical staff felt like it was better to take care of our patient by letting them lay around in bed a lot, and that ended up causing actually more complications. And so what we've done on the other side is really understood that getting up and moving sooner actually helps you heal better and prevents these complications, and a lot of these tools come from that. So bladder catheters that we used to use frequently, we don't use as much anymore, and if they are used, we get them out as soon as possible. So that's one of the reasons why we have all of our patients try to get up and walk the day of surgery, because as soon as you can get up and walk, then you don't need the bladder catheter, and then you won't be having bladder infections from that. Okay? And preventing constipation, we talked about that earlier. It's very important that you don't become constipated, and one of the things that really helps with that, besides drinking lots of water, is to get up and walk. So again, another good reason to get out of bed sooner. Pneumonia used to be an issue with post-surgical patients when people would lay around more. So this device was developed so that people could exercise their lungs. All of our surgery patients get one of these. You'll be instructed how to use it while you're here. It's a breathing in exercise for your lungs. So all of our patients get one of these. I'd take it home and keep working on that at home as well. But the other thing that helps with pneumonia is get up and walk. So we're going to really be putting this on here often, because we know how much this affects a positive recovery. And this is not just in the hospital, this is at home as well. Okay? So getting up and walking and using your lung exercisers is going to prevent pneumonia. Now, as far as preventing infection, All of our rooms have the alcohol dispensers outside the room, so all of us should be out putting alcohol in our hands as we come in and leave your room. So whether that's staff or your visitors, they need to be doing that. Antibiotics are given in your IV while you're in the operating room, but they are not something that you need to take once you go home because you don't have an infection. Okay, so the antibiotics that you get in the IV are to prevent infection. You don't have one. Okay, so you don't have to take them once you get home, but that does mean you do need to take good care of your surgical site. And we've got wonderful bandages that we use that seal that area, but you're going to be giving shower instructions from your nurse. So before you go home, you'll know if you're able to shower with that bandage on or not, and when to take it off or when to change it, okay? And then the last thing that we like to share is this gown that we use now at the hospital. And we have you put this on in the prep area. It's called the Bear Paw gown, and it's a warming gown. So what's so nice about these is there's little vents that they hook up a tube that warm air blows into that, and it keeps you all filled up with warm air. You're actually in charge of, you have a dial so you can say how warm or how cool you want that air that's pumping in there, but it works better than warm blankets because it stays warm. Okay, now the whole reason that we use these, even though we get a lot of patient satisfaction, because people love to have their gown be warm, but the reason we use those is because they fight infection. So studies have shown that if we keep the patient's body temperature where it should be, it fights infection. So you will have this gown on and warm in the prep area, in the operating room, in the recovery room, and then in whatever room that you're staying in after surgery. So just want you to know that you get to stay warm and cuddly the whole time that you're here in the hospital. And it fights infection, and that's a great thing, okay? And then the last thing that we like to instruct our surgical patients about is preventing blood clots. That is something that can happen due to inactivity after surgery. Okay, so back again, when we let people lay around after surgery, it created a lot of complications. You get up and moving right away after surgery, we can prevent most all of these. Okay, so specifically preventing a blood clot. Now, typically where you would feel a blood clot after surgery would be in the back of your calf here, and that would be swelling, pain, and redness. That's where we would look for that. These are ways that we prevent this, okay? So the hospital has this device here on all of our surgical patients. This goes around your calf because that's typically where the blood clot would form if it was going to. This tube here hooks up to a motor that blows air in here sequentially, one compartment at a time. So it's like a massage going up your leg the whole time it's on and squeezing, and that prevents the blood from pooling back here, which would cause the blood clot. Okay, so while you're not moving much, these will be on and squeezing while you're here in the hospital. What's important is that you understand that that's what's happening, so that when these aren't on and squeezing, you're doing your part by doing ankle pumps. Waving the feet up and down like that is going to keep the blood flowing as well as, look at that, walking again. Okay, so walking helps prevent so many of these complications. And people that I know of that have had back surgery, they wish they maybe should have walked a little bit more, because sitting around in the chair or laying in the bed makes the back kind of achy after surgery. So these short walks really helps with discomfort as well. Okay, so that's the complications that we want you to know that you can prevent. Now we're going to talk a little bit about pain management. Pain when it comes to back surgery can be a big conversation depending on how long you've put up with pain with the problem that you have in your back. And pain that you've put up with for a while is more on the chronic side, where acute pain means you had that from your surgery. So that's just happened right then, okay? And these pains are different. They feel different. And that's what we have to remember. If you don't have this surgery, whatever is causing your problem now will most likely get worse and continue causing that pain. So in this short time with the surgery, you'll have the surgical pain, but your doctor went in and structurally fixed whatever was causing that pain. So that's not going to be causing your pain anymore. It'll be the incision. And guess what? That's going to get better every day. Okay? So as long as you're eating your vegetables and your fruits and drinking lots of water and taking good care of your cells and getting up and moving, that's going to get better every day. Okay? So with back surgery, there's typically some damage to the nerves because something's been pinched. That can be kind of unpredictable as it's healing, depends on how long a nerve has been pinched. So you'll probably have some achiness and some throbby, that kind of feeling. It is definitely unrealistic to be pain-free right away after surgery. You've got the incision and you've got what's inside that needs to heal, okay? Our goal is to make you comfortable as much as possible, but there still will be some discomfort, okay? So what we really want you to be able to do is communicate well with us. You need to be able to tell us, what is your pain? How is it going? Is it getting better? Is it getting worse? Okay? Wanted to talk about the pain scale. We provide all of our patients while you're here in the hospital with our blue pain sheet, okay? This scale, this 0 to 10 scale that you see there is actually on the back side of our blue pain scale, okay? So you'll have one of these in your room. This is a great way to communicate how your pain is, all right? On this scale, it is from 0, that's no pain, okay, to 10, which is the worst imaginable pain ever, all right? So when the nurse asks you what your pain is, it can't be a 12. It's not on the scale, okay? So we have to be able to communicate well. We need to be within this scale that you see here, okay? Now, what we like about this scale is the fact that it has the faces, it's got the numbers, but it's also got these great descriptive words, all right? So if you're thinking, yeah, but this really feels like an 8 out of 10 pain, but you can still get up and do most activities, then maybe it's more like a 4 or 5. This is not pain-free. It's just that it could be worse, and when it is that bad, that means you're unable to even get out of bed. It's that bad. So we have a scale to help us understand what you're going through, and those words help so much. So we would love for you to kind of study this before you come in for surgery. Figure out, where's my pain now? Do you live at a 4? Do you live at a 6 or a 7? So that you'll be able to make realistic goals after surgery. Okay, because if you're living at a 7 all the time, don't expect to be a 0. Unmet expectations make people unhappy. So you got to understand, okay, I don't expect to be at a 0. Could I be a 3 or a 4? That will be a relief to somebody that lives at a 7. Yes, there's still some pain, but you can get up and walk. And we're on the good trend to be able to be recovering. Okay, so this is the best way. If we use a scale like this to help you communicate what your pain is, then it's easier for the staff to medicate you appropriately. Because we don't want to give you too much pain medication, but we want to give you enough. Okay, so that's why this works so well. Other things that help with your discomfort after surgery will be resting positions that make you comfortable with your knees supported on pillows, ice packs to the surgical site, typically before surgery, and sometimes ice can help before surgery, but a lot of times heat feels good before surgery on your back pain. If that's the case, we don't like you to use heat after surgery because that can inflame that incision and the tissue trauma from that incision. So the ice packs are what we want you to use after surgery, okay? But that's really great pain relief, kind of numbs the area and decreases any swelling and inflammation, okay? So in your book, we've got a recipe for ice packs you can make with rubbing alcohol and water in a Ziploc bag. Make slush because alcohol doesn't freeze. They can be real cheap ones like that. You can go to the pharmacy and buy the gel packs. Those are nice as well. So just have some ice packs on hand so that you can use those for pain relief after surgery. Getting up and going for walks really does help. It will feel like it's counterintuitive at the time because you're hurting, but actually after the walk, you're going to, oh, I'm so glad I got up and did that because it feels better. So just know that. And then these are the things to avoid after surgery. There's no heavy lifting, and to use anything that can help you. And I have a picture of some equipment that will help you after surgery as well. So just keep all that in mind, not sitting on anything too low, that kind of stuff. Okay? So when we talk about your goals to be able to leave the hospital, when we say we want your pain to be managed, that means it's somewhere in there. Don't expect it to be a 0, but it's functional. You can get up and move. And that can be with Tylenol only, or it can be with a little bit of pain medication if you need to. You need to be able to be functional. You got to get out of bed and be able to make it to the bathroom and walk on your own. Understand your spine safety precautions and correct body movements before you go home. If you have a brace, that you can get that on and off, be able to get in and out of bed, on and off the toilet. And this is why we like to have, if you have your helper from home, be able to come in like early in the morning, 8 o'clock, 9 o'clock in the morning, the day after surgery, if they can be there for all of this teaching, because you don't have to do this on your own. It's okay to have your spouse help you get your back brace on, that kind of stuff. So if they're here and available, we can do all this teaching with both of you as well, okay? Understanding your discharge instructions and how to take care of your incision and how to take your medications, to have the two of you here to hear all that works really well, okay? And then specifically, your nurse will have discharge instructions to go over with both of you. Whoever's taking you home needs to be here to review your discharge instructions with you before you go home. All right. So as you heal up and you want to do more and more activities, these are the things your surgeon will discuss with you. Being able to drive, they're going to decide when it's time to let you drive, to be able to sit much longer doing computer work, any lifting more than that 5 pounds, and doing the more heavier activities, which are the fun things that maybe you want to get back to, but it just needs to be in a timely manner so that the surgeon's allowing you to do those when it's safe for your spine surgery, okay? So make sure you get those answers when you go in for your follow-up appointments with your surgeon, all right? Make sure you feel comfortable and confident to ask any questions that you need to ask. And I like to put a plug in here for your outpatient physical therapy. This is what my background's in. And unfortunately, a lot of times physical therapy is tried before you have surgery to see if we can make it better without having to do surgery. So if you're having surgery, then maybe you feel like the therapy failed. But what needs to be fixed, the surgeon needs to do. And then once that's fixed, your physical therapist in the clinic can work one-on-one with you for exactly what it is that needs to happen in your body, what is weak, what is strong, what needs to be stretched, and give you specific instructions for you to be able to get that core strength and to be able to get into these higher level activities that you want to get back to. Just because you need spine surgery doesn't mean you can't have an active lifestyle again. And that's what we really want to encourage you with, okay? Here's your spine precautions, okay? Minimal bending, lifting, twisting, and turning. Not lifting more than 5 pounds. Avoid sleeping on your stomach. Do not sit more than 30 minutes at a time. Talk with your surgeon before starting an exercise program. Do not drive until you have your surgeon's clearance. Wear a brace if ordered. And our neck patients are not to lift over your head. We tend to call these your BLTs, your precautions, because there's no bending, lifting, or twisting, or sitting too long. BLT. Here's some demonstration of those comfortable positions just to give you an idea. The way that the spine is set up, if you lay flat, that can put your low back at more of an angle that is not comfortable. And just by bending those knees up a little bit, you can put your low back at a more comfortable position. So just a couple pillows can help with that. Your low back will be more comfortable. And then be pretty specific with the pillow that you choose if you're having neck surgery. Ask your surgeon if they have a recommendation for that. This position on the side works really nice for the spine. The pillow between the knees to support that upper leg makes it so it doesn't pull on the low back. And in this position, you can bend those knees to whatever position makes your back feel the most comfortable. And notice this pillow is just enough to keep that spine in good alignment. Okay, not too much, not too little. So having the spine lined up is what's going to be the most comfortable while you're recovering. This maneuver here is called the log roll. When you do this, it's really supporting your spine as you do functional things like getting in and out of bed. By bending the knees up and rolling the knees and the shoulders at the same time, so you get on your side, and then you can use your hand here as your feet come over the edge and it lifts you up. Didn't put any pressure on the spine. If you try to sit straight up out of bed after surgery, that puts so much pressure on both your neck and your low back. And you can reverse this to get back in bed. So look at this and study that before you come in, because the first time we have you get out of bed after surgery, we want you to do this. So practice this before you even come in. It will probably make it easier for you now as well. To lay down, come down onto your side, hook your heels on the edge, and then you roll back, and then you can just position yourself comfortably from there. That's called the log roll. This is an example of good posture and bad posture. I like to talk about this because now that you know the anatomy a little bit better, you know how heavy this is that we have on the top of the spine here. You get that out of posture at all, it's supposed to be lined up, supported over your spine. If that gets into bad posture like this, which is typical for us, gravity is pulling down on this heavy head that we have here, and it puts a lot of pressure and pain through the neck and even slouching in the low back. So if we can sit up with good posture, that's going to support the weight of our head better and be less painful. Very important. So your furniture needs to support that. The stairs here, up with the good, down with the bad is our motto as far if you have a weak leg. And then hanging onto that railing is very important. If you spend the night in the hospital and you have stairs at home, our therapist will have you practice that before you go home. Make sure you're confident in that before you leave us. Here again is an example of spinal alignment that is going to be way more supportive. Soon as that head gets way over here and gravity's pulling down on that, we've got pain here, we've got pain here for sure. We use our legs to bend over, and you keep that spine in good alignment. That's protecting all those areas, which means we got to have strong legs too. Here's my last slide, and this just gives you some examples of helpful equipment for after surgery. If you need something like a front-wheeled walker that will help you stand up straight and tall, just let you put a little bit of weight on that walker as it's wheeling and you're walking. If that gets you up and moving, that's a great thing to have after surgery. It's not something that you will have to have forever if you don't use one now, but don't be afraid to use one of those for recovery. It'll help you get up and moving. These are examples of some braces that the doctor might order. And this is an example of a raised toilet seat with armrests, so you can get on and off the toilet independently. Independence is a good thing to have there. And then these are examples of long-handled tools that help you be independent in reaching your feet and reaching any distance. And that's difficult to do if you've had spine surgery. We use these with our total hip patients because they're not allowed to reach their feet after having surgery here. So you might find these in a kit at the medical supply place called a hip kit, and that's why it's called that, but it works great with our spine patients as well. Well, I hope you found that information helpful, and I wish you a very successful surgery.